Alrighty, everyone, we'll go ahead and get started. So welcome everyone to the 2022 PI conference. We will get started in just a moment, but wanted to highlight that Spanish interpretation is available for this session. You can access the Spanish language line by clicking on the world icon in your Zoom toolbar. My name is Rebecca Russ. I'm the Grassroots Advocacy Specialist at IDF, and I will be your moderator for this education event. Today, Stephanie Steele will be presenting on navigating health insurance. There will be time for questions at the end of the presentation, so please submit any questions you may have for Stephanie in the Zoom chat. Stephanie Steele is our Director of Payer Relations and Policy at IDF. She attended the Ohio Institute of Health Careers, receiving her degree in medical assisting. She joined IDF's team with 10 years of experience as a consumer advocate and manager with specialty pharmacies, where Stephanie obtained extensive knowledge of insurance, payer, and policy issues. So with that, we're going to turn it over to Stephanie. Welcome, Stephanie. Thank you for joining us.
Thank you very much. I'm happy to be here. Thank you all for joining us today for this session on navigating health insurance. Let's go ahead and get started. We're going to get started with some basic health insurance terms. Okay, so we're going to get started with coordination of benefits. Coordination of benefits, it determines which plan is going to be paying first. If you have two different insurances, that will just let us know who will be the primary payer. Will it be, which plan will be paying first? Next, an ABN, an Advanced Beneficiary Notice. This is a form that helps Medicare beneficiaries make informed decisions about services or items that may or may not be covered in a specific situation. Next, an explanation of benefits, or your EOB. These are those letters that you get in the mail, and it shows you what's being paid and how. And it'll say, this is not a bill. You'll wonder, oh no, do I owe this? No, it's just telling you how things are being paid. So that's what an explanation of benefits is. Next, your out-of-pocket. This is the maximum amount that you will be required to pay for services in a year before the plan will be covered at 100% of all the costs. So this generally includes your deductible, your coinsurance, or all co-payments, and it varies from plan to plan, but not premiums. Plans can be set at different out-of-pocket limits for different services. Next, it's a PBM, Pharmacy Benefit Manager. Health plans and sponsors contracts with pharmacy benefit managers. PBMs develop and maintain a program drug formulary contract with participating pharmacies and negotiate drug discounts and rebates with drug manufacturers. Skilled nursing facilities, or SNFs. This is your long-term care facility. So when you hear someone talk about a SNF, that's what they're discussing. Long-term care facilities. Commercial insurance. You can get this from your employer. It can come from the marketplace, healthcare.gov, or through your broker. Upon choosing your plan, you want to look at a lot of different variables. Is my provider in network? You also want to look at the out-of-pocket cost. If you don't go to the doctor that often, you might want to look at the out-of-pocket and see, is that really the plan I want to choose? Do I want to go with a higher copay, a higher out-of-pocket, a lower out-of-pocket? You also want to look at the formulary and see if that's provided. You want to look at the deductible and see if that's an amount that you're comfortable with paying. Understanding your rights. So pre-existing conditions are a thing of the past. That's not something that we have to worry about anymore. It's extremely important for our individuals that have PI. We don't have to worry about that now when we're changing plans. Also, there are no out-of-pocket costs for preventative services when you're working with an in-network provider. Those are your mammograms, your colonoscopies, those type of services. Also, there are no annual or lifetime caps on all plans. This is very important for individuals that have primary immunodeficiencies, considering the costs that come with IG therapy. Also, if you're a dependent, you can stay on your parents' plan until you're 26 years of age. It's very important. Let's hop over into Medicare. Medicare Part A. This is our hospital insurance. It helps cover inpatient hospital care, skilled nursing facilities, hospice, and home care. Most beneficiaries are automatically enrolled. Now, when it comes to IG therapy and Medicare, how IG products are billed through Medicare is strictly based upon your diagnosis code. The diagnosis code is determined by your clinician, and it's strictly based upon your labs, your clinical history. It can't be just chosen. It's strictly based upon your labs. So there's a list of qualifying and non-qualifying diagnosis codes. If you have a qualifying diagnosis, that will always go through Medicare Part B as in boy. If you have a non-qualifying diagnosis, it will always go through Part D as in drug, always. Now, open enrollment is coming up. That is going to happen on October 15th, and it will end December 7th. During this time, people eligible for Medicare can compare 2023 coverage options. You can do this on medicare.gov. There's also a Medicare Plan Finder. This allows people to compare options for health and drug coverage, which may change from year to year. Now let's talk about Medicare Part B. So with Medicare Part B, you're required to pay your deductible. Medicare Part B will cover 80% of the cost of your medication. A secondary or supplement will cover the other 20% of that cost. Now with Medicare Part B, prior authorizations are not required. They are not required. You will not need one. You are on sub-Q therapy, the cost of the supplies are covered. If you are on IVIG, you will need to sign up for the IVIG demonstration project, as the cost of nursing and supplies are not included. However, the demonstration project will cover the cost of nursing and supplies. This is something that you'll need to sign up for annually. Now, this is something that IDF is working on to try to make this a permanent benefit through Medicare. We're working with our legislators and hoping we can do this within the next year. Also, it's good to know when you're filling out this form, every piece of this form must be filled out, every portion of it. If you leave part of it blank, you're going to be denied and you're going to have to start the process over. It's important that your physician and the patient sign it. And it has to be turned in by the 15th of the month to be eligible for the following month. If you turn it in on the 16th, for example, this being October, if you get in on October 16th, you won't be eligible until December 1st. So you want to pay attention on that timeline. Here's the first part of the list of Medicare qualifying diagnoses. You'll see CVID is on this list, as far as also XLA, Wiskott-Aldrich. I'll give you a moment just to look at these. Here's the second part of that list. SCID. And most recently added is D80.3 and D80.6. The selective deficiency of immune globulin subclasses and antibody deficiency. Those were added just a few years ago. Now, any that you do not see on this list would be a non-qualifying diagnosis or one that would go through Medicare Part D, as in drug. So let's move on to Medicare Part D. Okay, you are responsible for your annual deductible, $233. Next, this is where we talk about the donut hole, the $7,550. Once that's been met, you're going to enter the catastrophic phase. Now, you get through the donut hole. When you're in the catastrophic phase, I'll use a specialty pharmacy, for example, you will pay 5% the total cost of the drug for each shipment that you receive. Prior authorizations are required for Medicare Part D. They are required. When you think about your ancillary medications, say you're on IVIG and you get hydration, your saline flushes, if you get heparin, or if you need Tylenol as a pre-med, all of your ancillary medications are going to go through Part D as well. If you're on sub-Q therapy and you get the numbing cream, that goes through Part D. Now, all this being said, there's good news on the horizon because we just had a bill passed and it's called the Inflation Reduction Act. Now, let's talk about that because this is great news when it comes to this out-of-pocket cost. Starting in 2024, that 5% coinsurance is going to be eliminated once you get into that catastrophic coverage. In 2025, there will be a $2,000 cap on the Part D out-of-pocket spending. That's huge. We're so thankful for that. $2,000. The other good thing is that $2,000 does not have to all be paid at the beginning of the year. That can be spread out over the entire year. So you don't have to come up with all that money all up front. It's great news. Also, this expands eligibility for Medicare Part D, LIS, or low-income subsidy benefits. And we're going to go into LIS in a bit. This also requires drug companies to pay rebates if drug prices rise faster than inflation. It improves coverage for adult vaccines in Medicare Part D, Medicaid, and CHIP. And then on another note, it limits insulin copays to $35 a month in the Part D benefit. It's fantastic news. Okay, Medicare Part G, this is your Medigap. This is that secondary health plan to Medicare Part B that helps cover that remaining 20% that Part B doesn't cover. All right, we've all heard of Medicare Advantage plans. Medicare Advantage plans are tricky in that they don't have to follow traditional Medicare guidelines. So let me give you an example. Let's say you're an individual, you have a diagnosis of CVID. So you're sitting pretty over here with your medication being covered by Medicare at 80%. Your secondary or supplement picks up that other 20%. You're good to go. You're covered. Say you sign up for an Advantage plan. Well, they don't have to follow those traditional Medicare guidelines. And you are on the phone with your specialty pharmacy and you find out that that Advantage plan, they can bill that any way they want. And all of a sudden, they're going through Medicare Part D. You have that big out of pocket and you didn't know that was coming. So Advantage plans can be very tricky. So keep that in mind with open enrollment coming up. You don't want to be stuck with a huge out of pocket when you can follow traditional Medicare. LIS, low income subsidy. So this is a plan that Medicare, it's a Medicare program that helps people with low or limited income, and it provides resources to help pay for prescription drug coverage, low premiums, low deductibles, low co-insurance. You can apply for low income subsidy by following these 3 steps. You go to medicare.gov. There's a place that'll take you to the LIS portion of that. You can find out if you're eligible by using the Extra Help calculator. You contact the Social Security Administration, and then you can also get in touch with a licensed insurance agent. I have seen copays for individuals that have Medicare Part D as low as $4. So if you have low income, go ahead and see if you qualify for LIS. It's very beneficial. Everyone's favorite, denials. They happen more often than you would think. They really do. So denials are sent, copies of the denials are sent to the patients and the physicians. They're not sent to your specialty pharmacy. The reason for the denial will be on that, or the reason the insurance company is denying the medication will be on there. It's very important. Your specialty pharmacy is going to need that information. So when you're doing an appeal, the best way to have that done is to have your physician do a peer-to-peer review. The doctor can call and get an answer immediately. It's also best if the physician can speak with an immunologist. An immunologist knows most about your particular disease state. So it's best if the immunologist can get another immunologist on the phone. So after 2 appeals, you have to go to an external appeal. Copay assistance. So manufacturer copay assistance is available for all of the products. They don't look at your income. Just because you're on the product, you get the assistance. This is regardless of your household income. Now you have to sign yourself up. Your specialty pharmacy can't do that for you. This assistance can go towards your copay, your deductible, or your out of pocket. And this does not cover the cost of nursing or supplies. Typically, it does not. And also, you need to know that if you are on Medicare, or if you have TRICARE or Medicaid, you are not eligible to use manufacturer copay assistance. Also, specialty pharmacies sometimes can offer assistance. However, you have to ask. They cannot just tell you, oh, we have financial assistance program. Can we get you signed up? It's enticement. They can't do it. Make sure you ask your specialty pharmacy to see if they have assistance available. Also, there are different nonprofit organizations out there. The Assistance Fund, PSI, and the Patient Assistance Fund. Okay, I have some tips. It's extremely important to keep copies of all of your original blood work and clinical information when you are originally diagnosed. When you change insurance companies, they're going to need all that information. When you go on to Medicare, they're going to need all of that information. I have seen individuals that have had to stop therapy for 6 months and have to go all through a pneumococcal challenge all over again, having a whole workup because they haven't been able to find their paperwork. They haven't been able to find their labs just because they don't have it. They can't find it. So it's extremely important. If you don't have that now, find it. Go back and get it. Keep it in a very safe place because you're going to need it. It's also good to know if you're on IVIG and you're not tolerating it well, you are not stuck on IVIG, or you're not stuck on one particular drug. If you're not tolerating it, talk to your doctor. If you are not stuck with one method of administration. If you're on sub-Q and it's not going well, go ahead and have that conversation. There are so many things that can be tweaked. So make sure you have these conversations. You don't have to be miserable in your therapy. There are so many things that can be changed. Something else that I've seen recently. I was on the phone with an individual and she hadn't had her medication since January. And the pharmacy just said, your insurance won't pay for this anymore. But what they didn't tell her was that they wouldn't pay for that product, but they would pay for another. It just turned out it was a formulary situation. So sometimes that's what it is. If they won't pay for one drug, doesn't mean they won't pay for another. So ask. Next, let's make sure we're getting the most out of our specialty pharmacies. The pharmacists are so knowledgeable. If you have a question, don't hesitate to contact your specialty pharmacy and talk to a pharmacist. They have so much knowledge, so make sure you're reaching out to them. Also, our specialty pharmacies have nursing and they have staff on call 24 hours a day. Make sure you utilize that. Next, let's talk about what happens when your prescription is sent over to a specialty pharmacy. Your doctor sends over your prescription. They're going to get your prescription and that's going to go over to their benefits department. They're going to do what's called a benefit verification. They're going to, number one, see if they can service you. They'll see if their pharmacy is in network or not. They're going to check your benefits. They're going to see if the drug that the doctor wrote for is something that's on your formulary or not. And then they're going to start the insurance authorization, which can take up to 60 days. Once that's approved, they'll work on getting nursing set up. They'll reach out to you, see when's good to get that set up. You'll get started right away. But make sure you get the most from your specialty pharmacy. There are so many things that can be tweaked. Okay. Go ahead and move on to our questions.
Wonderful. So thank you, Stephanie, for that in-depth overview of the very complicated world of health insurance. We have some time for Q&A, as Stephanie said, but before we begin, just remember that everyone's treatment and condition are unique. The information presented during this session is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with questions concerning a medical condition. So we haven't had any questions come in yet. If anyone had a question about anything that Stephanie talked about, or something that maybe you had going on in your own life that you want to ask, please feel free to pop that in the chat box. Alrighty, we have one here. Someone asked, when considering a job change, how do you investigate coverage, especially coverage for, drugs that are treating PIs?
Well, your insurance, the insurance is going to have, they're going to cover some type of product, some type of IG product. You don't know what's going to be on the new formulary is what's going to be the kicker. So if you can find out the formulary, that would be ideal. I would try to number one, look at the plan if you can. And then if you can get your hands on that formulary list, that would be ideal because you don't want to have to change product. And yeah, I think but they're going to offer some type of IG therapy. It's just, you don't know what's going to be on the formulary.
Great. We have another question asking if Medicare gap insurance can exclude you due to a pre-existing condition after the age of 65 enrollment.
No. We don't have to worry about pre-existing conditions now. Thank goodness.
Yeah, we have another question here asking why prior authorizations must happen every new year when nothing has changed medically.
That's a great question. Honestly, it's extremely frustrating and we shouldn't have to do that, but the insurance companies are frustrating. So we shouldn't have to, but that's it. They're frustrating. We shouldn't have to. And unfortunately, we're even starting to see them become more frequent than yearly. I've seen them as frequently as every 3 months. So if you get to go a year, you're fortunate, to be quite honest. It's getting more and more ridiculous. There's no good reason for it, honestly.
All right, we have another question here asking, is it possible to fight with a Medicare Part B insurer if a pharmacist tells you the plan won't cover an immunization ordered by your doctor, but Medicare only authorizes it after some date in the future?
So I've seen this, honestly. So they have the right to refuse that. I would just go to a different pharmacy. It's so incredibly frustrating. You're just going to have to go to a different pharmacy and find a different pharmacist. But we're seeing that more and more. It's terrible.
We have another question here, Stephanie. This person said that not everyone can afford a supplement to cover the 20% out of pocket for Medicare. How should you move forward without a supplement and no income to cover that 20%? They also said that this person is not eligible for LIS nor dual eligible for Medicare and Medicaid. How can that person afford their IG replacement? Do you have any ideas for that individual?
So this is actually a huge problem. And we at IDF know this is a huge problem. Honestly, there's no good answer. It's terrible. There is no good answer. And there are a handful of individuals that are in this very situation. Most of the time it's individuals that are on disability. And the plans are too expensive and there's no good answer. And I hate to say that, but it's true. There is no good answer. And it's a horrible situation. And we know that it's a huge problem. And that is something that the policy team knows. And we know it's a huge problem and we're working on it, but there is no good answer. And I'm sorry. It's terrible. I hate to say it. I'm sorry.
So our next question is, can an insurance company require me to do sub-Q at home rather than in an infusion center?
You cannot do sub-Q in an infusion center. The only sub-Q drug that you could do in an infusion center is HyQvia. So yes, they can make sub-Q is meant for self-infusion. You can't do sub-Q in an infusion suite.
We have another question asking, can Medicare Advantage plans charge more for someone on Social Security disability when they are under the age of 65? This person says that in their state, the only other option is a very expensive state-sponsored gap program.
Do you mind repeating that? I'm sorry.
Yeah, absolutely. They said, can Medicare Advantage plans charge more for someone on Social Security disability when they're under the age of 65? In my state, the only other option is a very expensive state-sponsored gap program.
You know what? If this individual wouldn't mind, would they please send this to Ask IDF so that I can investigate this further for them?
Yes, and that's perfect. Stephanie, we actually had someone ask, how can they reach out to IDF about insurance issues and the like. So that's a perfect time to highlight. We are going to do this later anyway. If anyone has, very specific questions that they would like to discuss at length with Stephanie and, get a direct answer to, we always have the Ask IDF feature as well. So I want to make sure everyone knows about that.
Yeah, I'm going to have to investigate that. Sorry, I don't have an answer right off the top of my head for you, but I'll definitely look into it. Yeah, please don't hesitate to reach out to Ask IDF.
Looks like that's the last of the questions that we have right now. Did anyone else have a last question before we wrap up the session?
I do have one more thing that I want to bring up.
Absolutely.
Many of you probably don't know this. If you enter a skilled nursing facility, you cannot get your IG therapy there. And this is something that IDF is working on with legislators. This is a huge, huge problem. If you have Medicare, it will not be paid for. We are working diligently on this because it is a huge problem. If you want to reach out to your legislators and let them know that this is a problem and that it's not okay. If you want to help us and reach out, we would really appreciate it. It's absolutely unacceptable. It's terrible. And it's something, again, that we're working on diligently because people are going without their medication and it's not fair. So I will end on that. If you want to help us out, that'd be great.
Wonderful. So our time together has come to an end, everyone. Thank you again, Stephanie, for joining us. It was really an honor to have you with us today. And as we mentioned before, if anyone has specific questions for Stephanie about your own health insurance or just want to talk through your issue a little more, you can ask IDF by going to our website and she'll be able to help you directly. Thank you again, everyone, and enjoy the rest of the conference.